This week's Ask Dr. Durie is a rather common question. The questioner asks, how is it that Revlimid and dexamethasone work together against myeloma? And the question is based on the notion that both of those agents are immune modulating agents. In the case of Revlimid, it's called an IMiD. Well, both Revlimid, an IMiD, and dexamethasone work directly against the myeloma, and so in that sense they are good partners and work well together in the initial therapy of myeloma. But dexamethasone is a steroid, what's called a glucocorticoid, which has a variety of other effects, including immune modulation. It can actually deplete some cells in the immune system. And so the questioner is correct. Is it smart to be using the dexamethasone along with the Revlimid if it is potentially actually harming the immune response, which we know is certainly important to fight against the myeloma? And so this is a very, very reasonable aspect to consider. And so the way that we as myeloma investigators look at this is that at the point of initial treatment, when a patient has relapsed or has just been recently diagnosed, using both drugs together is the best way to get the attack against the myeloma and to reduce the disease. However, with ongoing therapy, and particularly for maintenance, it's a good idea to drop the dexamethasone and just get that immune modulation from the Revlimid as a maintenance approach, and to stop the dexamethasone, which, as I said, has a variety of side effects, including impairment of the immune response. And so, bottom line, both drugs should be used and can work very nicely together to initially produce a response. But for maintenance, it's a good idea to use just simply the Revlimid, and if both drugs have been used initially, to taper off the dexamethasone so that you end up with a low dose like 10 milligrams of Revlimid 3 weeks out of the month as a maintenance approach. And so depending on the status of the disease, then both agents have their uses.